Okay, this is Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Please remember that these videos are not intended to replace visits to your doctor's office, but they are here for educational purposes. If we can be of assistance, give us a call. We'll be happy to see you here at our office. Area code 775-359-7111. We can't really help you over the internet, nor can we really help you over the telephone, because that's just bad medical care and not really something we're in a position to do. Today what we want to talk about is myelomeningocele, also known as Spina Bifida. And this is at the request of my friend Greg from Scouts back in the day, who is asking for a little bit of information, so we're happy to do that for him. So what we really want to talk about, if you watch the last video that talks about the various types of spinal dysraphisms or spinal diseases in kids, you know that myelomeningocele is really one of the worst of these group of diseases. And what we want to look at are some of the complications, things to watch out for when you're taking care of these kids, either at school or at home. And I think the most important of them is something known as shunt malfunction. So what happens in these kids is they tend to build up pressure in their brain, and that causes the brain to swell as an infant. So to avoid this, we actually put a small tube from the brain, tunnel it under the skin in the neck, over the collarbone, and down into the abdomen where it sits, and it drains fluid out from the brain. But these shunts can get either infected or broken or clogged. And this is probably one of the worst complications for patients with spina bifida. And if your patient has a shunt, or the child you're dealing with has a shunt, it's something you need to be aware of and pay close attention to. Not every kid with spina bifida has a shunt. You can ask them, they'll know. Side effects of, or signs and symptoms of a shunt obstruction include severe headache, especially worsening headache, often migraine-like, vomiting, with or without the headache, pain at the site of their myelomeningocele repair. Remember that they have a defect in their spine, in their back, in their low back, that was open at birth. This is patched at birth, but the pressure will build up there, and so they'll start to have a lot of pain at that site if the shunt is not draining fluid out like it's supposed to. You can have changes in behavior. So I'm using the Greek letter delta here. This is the scientific notation for change in behavior. Kids can become more agitated. They can become lethargic. They can have increasing attention difficulties. School failure. Start falling asleep in class, so they're failing, or just in general having difficulties focusing in class. They might have seizures, and they may have decreasing strength or function in their lower extremities. That would be legs and feet. Either trouble walking or weakness, something along those lines. Now that can be difficult for patients with myelomeningocele, that last one, because they often have a lot of difficulty with their lower extremity strength anyway. So this may not necessarily be something particularly new for the patient. Other things we worry about in these patients: kidney infection. Okay, this may be manifest with fever or bad smelling urine. or the urine. In these patients, their urine is often already pretty cloudy, but it'll be increasing cloudiness. Those are all reasons to discuss that with your doctor sooner rather than later. We have ortho problems. Okay, and their orthopedic problems include, but are not limited to, fractures, broken bones anywhere. This comes from immobility, from lack of exercise, just in general makes the skeleton weak. They can have skin breakdown. Again, this can come from immobility. It can also come from any of the uh, splints or braces that they may need to use or wear, especially if they're active. Scoliosis or crooked spine, again, comes from muscle weakness and fractures of the spine itself. Back pain, made worse if they're carrying heavy backpacks. Sway back, or what we call lordosis. And numbness or weakness at or below the level of the defect in their spine. And you can see the site of the defect in their spine. I mean, if they pull their shirt up, you can see where the surgical scar was, so it's not like this is any great secret. The shunts can get infected. That's always a fun one. That looks a lot like shunt obstruction, although these patients will often have seizure or fever to go with it. Constipation. The innervation to the bottom part of their intestines does not work right many times, and so chronic constipation is a problem. It can be so severe these patients can start with abdominal pain, vomiting, or they can actually increase the pressure in their belly, resulting in shunt malfunction. And yes, that says dysfunction right there. I was running out of room, and those of you who have worked with me for a while know my handwriting is not the greatest. For that, I apologize. Greg may remember that back from our scouting days together, if I ever signed any papers with him. And then last but not least, a major one to consider with these kids is latex allergies. These kids oftentimes will have to catheterize themselves to get the urine out because their bladder doesn't function, or they'll have to actually catheterize their colon and give themselves irrigant through the colon in order to get the hard stool out. In both cases, it sensitizes them to latex, and that can be a very serious problem. So you need to be careful if you're dealing with something like scouting or a school district. You want to avoid latex gloves. Use the nitrile gloves instead. Certain foods, avocado, and that's a C there, not a D. Banana, cantaloupe. All of these have natural latex in them. These are all things that have a reasonably thick skin, but underneath that skin it kind of peels off easily and it's kind of slimy underneath. That doesn't mean these aren't yummy foods. These are foods that they usually cannot eat and that's not an P, that's an L. These are foods they can't eat, and they got to be careful about being exposed to, because signs of latex allergies include rash, swollen lips, trouble breathing, and then just collapse and death. So none of these are things we want to deal with, especially on a camp out. So those are just some things to think about in dealing with patients in your community, in your church, in your daycare, in your scout troop who may have spina bifida. So hopefully this gives you the information that you need at least to start with. Once again, I'm Dr. Windisch from Sparks Pediatric and Adolescent Medicine, and we're happy to see you here for consultation. If we can be of help, be of assistance, give us a call. Otherwise, we'll see you next time.